Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of the Keeping Ashland Healthy podcast. My name is David Ross. I am the Executive Director here at the Mental Health and Recovery Board. And today I wanted to spend a little bit of time talking through a recent publication of the Ohio Suicide Prevention Foundation. It's from their July series of resources. It's entitled The Impact of Stigma on Suicide, and I just was intrigued by the title, and then when I had a chance to review the content, I thought the audience would be interested in what I think is a very practical suggestions on how to approach this and how we might do a better job with stigma, particularly in the area of suicide. So there are, as we know, negative outcomes when people hesitate to talk and share what's going on with them. And particularly around suicide, which already has its own stigma attached to it. So I think it's an important thing as we try to reduce suicide in Ashland County to zero, that we break the stigma associated with suicide by encouraging folks to speak up, to talk about what might be troubling them, to seek support from whether family and friends or professionally. And just remember that mental health is health. It's just as vital and real as any physical condition. That's something we've stressed. You can't be healthy without both physical and mental and emotional health. These things really go together. So three things I'm going to try to cover. What is stigma? Why is stigma a problem? And then what can be done about it? And then within that, maybe we'll talk about maybe 4 or 5 ways we can reduce stigma on a practical level. So first and foremost, what is it? There are various definitions out there, but let's go with stigma referring to some of the negative attitudes or beliefs and stereotypes people may hold towards those who experience mental health conditions. Mental and emotional conditions, particularly suicide, continue to have high levels of stigma. Although, in fairness, I think we've done a better job, not only in Ashland County, but in the United States, as COVID was an opportunity to talk, I think, much more openly and frankly about some of the challenges we all experience, and COVID brought that to light. But there are 3 kinds of stigma, maybe a way to think about it. Structural stigma is built-in stigma, if you will. So this would be stigma that involves maybe laws, regulations, policies that can limit the rights of persons that might be struggling with mental health conditions. Public stigma is another type of stigma, which includes negative attitudes and beliefs from either individuals or larger groups towards people with mental health conditions, or maybe those beliefs might exist within the family system itself or care providers. And then the third one is one that I don't think a lot of people consider, which is self-stigma. And what we mean by that is this is kind of a negative attitudes and beliefs that's coming with it from the person themselves. So people maybe living with mental health or emotional challenges, they might believe that they are flawed or to blame in some way for what they're experiencing. Now, to some extent, of course, these mental and emotional feelings, beliefs are coming from the individual. So it's easy to see how someone might identify themselves with that. I hope they do, because it is them having the feelings. It is them having the thoughts. However, it can be unproductive if we start to self-shame to a point where we don't feel like we can do anything about our situation. Because as a counselor, what I would often try to do is to reorient the person's thinking, because they're going to be the solution. They are a huge part of the solution to whatever's going on. A solution that involves entirely other people or other systems usually doesn't last very long. We really want that intrinsic or motivation from within the individual. We want them on board with any change. Any change that's lasting really has to involve the individual being part of it. So self-stigma, maybe that's not one you've heard about. So those are 3 different types of stigma. Why is it a problem? Well, when individuals hesitate to talk about suicide because of the stigma, studies that we have indicate that those impacted tend to suffer a loss of self-esteem, a greater sense of hopelessness and shame, and then they face elevated rates of unemployment, discrimination, etc. As a result of that. And there's a host of other things that I think can be experienced because of stigma. They're more likely to encounter bullying, harassment, physical violence when stigma is high. And then those that are impacted by suicide report higher levels of rejection, shame, and blame anyhow than other people that are going through loss. At the board, we've specifically designed resource materials for those that have lost someone to suicide because we know that grief and that bereavement process is different. But stigma basically acts as a barrier to help seeking for those with suicidal thoughts or prior attempts or who have lost someone to suicide. So it's a problem because folks don't reach out. Family members maybe don't feel like they can help to the extent they could. So it is a major problem. People, you've heard this expression, they suffer in silence. Maybe they don't feel for whatever reason that anybody wants to help them or should help them. So it can really be a problem in a variety of different ways. So what do we do about it? So briefly, what can be done to combat stigma? How you can help. So, if we think of it, if stereotyping, discrimination, and isolation are risk factors for suicide, then we can reduce the risk of suicide by responding to suicide ideation, thoughts of suicide, and attempts with the opposite, with compassion, with support, and connection. So again, we can intervene by being compassionate, supportive, and connecting with the individual that might be struggling. So some practical things here. Breaking the stigma starts with awareness and education, backed by different approaches of policy, programming, resources. So one of the things I've spoken of before on the program is working at the board. It really gives us a unique situation to bring about policy, programming, and resources to address issues like this, which the board has done. So we promote open discussion about mental health is important. We've tried to normalize the fact that everybody struggles throughout their life with mental and emotional issues, whether that could be prompted by relationships or moves or job stresses, economic stresses, legal stresses. There's all kinds of things. COVID was a health scare, a public health scare for all of us. And a lot of folks we know somebody personally or a friend that lost somebody due to COVID. So any of these things could be reasons why we need to talk more rather than less about what's going on. And again, so awareness, education, in the policy, programming, resource realms are critical. One of the ways we can promote open discussions about mental health is using language that doesn't stigmatize, right? So further stigmatize in the language that we use. That's important. I'm sure you've seen movies or read articles where we talk about people quote unquote committing suicide. That tends to be an older, blaming legal term that folks continue to use, and I don't blame anybody for that, but it's better maybe to talk about the person dying by suicide rather than committing. Again, it's less stigmatizing language. Setting appropriate policies and practices that support people with mental health conditions, reducing barriers they face in settings like workplaces. So what we're getting at there is making it more normal, acceptable if somebody's struggling to take advantage of their PTO, their pay time off, or the health benefits that the organization has in place. Anybody can struggle. In the work environment, it could be a combination of personal and professional things that are all coalescing at the same time. And most organizations and insurance plans have counseling built in. They've got opportunities for the individual to take a break, talk to somebody about what's going on, maybe learn some coping skills they didn't have prior to, and that will help them with their current situation. So, reporting about mental health responsibly. So, this is for my friends in the media, journalists, really anybody who communicates to folks in whatever, whether it's social media or print media, etc. The way that you report on some of these stories where maybe suicide was a factor, the language that's used could help change the tide so that folks maybe don't see suicide being reported as committing, but the person died by. I mean, just something as simple as that can go a long way. But again, just be sensitive to the issue when reporting can be a help in combating stigma. And then fourth here, treating those living with mental health conditions with empathy and acceptance so that no one feels that they need to hide their struggles. One of my favorite remembrances is we've talked about Pat Risser and the RSVP conference that honors Pat. He was a board member some years ago, and most of Pat passed away some years ago as well. But one of the things Pat and I talked about was, David, he said, you need to do something about the professionals, the counselors and the social workers being so uncomfortable having discussions with people seeking services around suicide. I asked him to, unpack that for me, tell me more what he meant. And in essence, what he was getting at was, he's like, David, from time to time, I might feel suicidal and want to talk to my counselor about that, but they were obviously very uncomfortable about me talking about suicide, and they immediately wanted to screen me to see if I needed a hospitalization. They immediately jumped to the worst case scenario, which was that I was getting ready to take my own life. And he would say, he's like, and I was not. And I tried to explain that to him. I just would have the feelings from time to time. So his reflection, and we took it to heart. We've tried to encourage our professionals to make sure that they understand there's a continuum. Just because somebody might be thinking about ending their life doesn't mean necessarily that they will or they're going to, but they really need to have that conversation to understand what's going on that has led to the person feeling that way. If we just immediately react and seek hospitalization, we are definitely missing out as a professional helping field. So we need to really understand more about what's going on, what is the person's intent in bringing up the subject, what is their desire to actually bring that to pass, and that just requires more of a conversation. What it doesn't imply is a quick decision that shuts down the conversation and just helps maybe the therapist feel less anxious, but it brings quite a bit of anxiety for the person that was just trying to share and get some help about these feelings. So I appreciate Pat, his comments on that. Maybe to end, let's talk about 5 maybe practical ways that all of us can reduce stigma. Be informed. First and foremost, educate yourself about mental health, mental and emotional issues. My hope is that folks listening to the Keeping Ashland Healthy podcast will find this one source. Our website is another. Talking with any of our contract partners at Appleseed Catholic Charities and Acada is another way to inform yourself. You can always call us, at the board offices if you have questions. 419-281-3139. We're always, as the audience knows, I enjoy talking about these issues and am always more than happy to provide resources locally that are reputable for you to have further discussions with. So be informed. Second, have conversations with others about mental health issues. Find trusted people in your life, your natural environment, whether that's friends, family, church members. Have these conversations with folks. Talk to them about what's going on. Obviously, the board does a lot of question, persuade, refer, QPR training, which is a suicide prevention, what we call gatekeeper training. So chances are there are thousands of people in the county that have been trained with this model. We train them to listen for folks that might be struggling, and then give them good information about where they can get help, and also information about going with them to get the help if the person would like that. Remember to use people first language. Again, the person is not the disorder. When somebody has a diagnosis of cancer or diabetes, we don't refer to that person by their disorder. So the same should go with folks with mental and emotional health issues. We shouldn't be labeling them by their diagnostic label. We should still refer to them as a person, because they are. Another thing we could do to reduce stigma would be to normalize mental and emotional struggles. All of us, you've heard me say this before, all of us experience mental and emotional struggles. Let's not assume every time something happens in our life as a result of maybe changes in relationships or finances and moves, educational work changes, that we immediately want to label that as an illness or a diagnostic issue. It could just be normal emotional stress as a result of changes in our lives. Okay, that's normal. So let's not always jump the gun. Consider those natural supports. Talk to friends, family, church, etc. Before jumping the gun. Obviously, if what's going on is debilitating, and what I mean by that is if you're no longer able to function the way you had previously been able to do, get up, care for your kids, your spouse, go to work, etc. If you find yourself unable to function the way you normally have, well, then it's probably a different level, and professional help is probably indicated. And then last but not least, let's recognize and remember self-stigma, holding those negative attitudes or beliefs about yourself. We need to do better to not beat ourselves up for things that, as I've said multiple times down the podcast, are fairly normal and common. I've never met anybody that didn't experience some struggles multiple times throughout their lives. So let's try to reduce that self-stigma. There is a place for self-reflection and doing better, but that's different than going over the top to when you're shaming and stigmatizing yourself such that you actually become your own worst enemy. We want to mobilize your innate ability to help yourself rather than the opposite. So again, basic things, the impact of stigma on suicide, talking about what it is, why it's a problem, what we can do about it. And this is drawn from the Ohio Suicide Prevention Foundation's July 2025 resource guide that they just released. So encourage folks to check that out for themselves at their website, which is ohiospf.org.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.